Okay, so we've reached 2 o'clock. So good afternoon, everybody. Welcome to this meeting of the Health and Wellbeing Board. I believe this is the first meeting that we have had under the virtual meeting regulations of the Health and Wellbeing Board. So I'll just take the opportunity to remind everyone of some of the protocols that we've been using as a council for these virtual meetings and publicly broadcast meetings. So we're using Microsoft Teams software to enable this virtual meeting. The proceedings will have the same standing and validity as a normal physical meeting in the town hall would. And obviously, as has been mentioned, this is being streamed on the internet via a YouTube link for anyone outside who wishes to listen in, and a recorded version of the video will be available on the council's website and on YouTube as well going forward. The etiquette for the Teams meetings has hopefully been circulated to members of the board and other participants. But please try to remember to mute your microphone when you're not speaking, just because it does improve the sound quality for everyone. If we can use the chat function within Teams or the hand raising function, if you've got that, to indicate that you wish to speak. And officers will hopefully help me to manage that as we go through. If you are invited to speak, I'll say your name so that we know who is speaking. But please do introduce yourself if it's the first time that you're doing so. And if for any reason you need to leave or return the meeting, please could you let me know that that's the case through the chat function, just so as we can monitor who's here and who isn't. If we require a vote for any reason, and we don't normally at the Health and Wellbeing Board, but if we need a vote for any reason, that will be through roll call, just so as we can make a note of who voted and which way. So before we go into the agenda formally, has anyone got any questions at this point around any of the protocols or technicalities? Nope, I can't see anything indicated, so that's really helpful. So do you want to just run through, Leo, who is present in the meeting?
I think Brent will take you through the roll call.
Brent, that's super.
Thank you, Chairman. Right, I'll just go through from the top of my list. Councillor Bell.
Present.
Thank you. Councillor Gibbons.
Present.
Thank you. Sheila Smith.
Present.
Thank you. Colin Bradbury.
Present.
Thanks, Colin. Matt Lenny.
Present.
Thank you. Georgie Bigg.
Present.
Thank you. Paul Lucock.
Present.
Thank you. Jeremy Blatchford.
Present.
Thank you. Councillor Griggs.
Present.
Thank you. Councillor Crosby.
Present.
Thank you. Councillor Tucker.
Councillor Tucker has apologies. Right.
Yeah, and apologies.
Thank you. Sarah James. Sarah James, we'll maybe come back to afterwards. Emmy Watts. Okay. Dr. John Heather.
Present.
Thank you. Dr. Shruti Patel.
I believe we've had apologies. I'll have to check that, Brent. But
thank you, Leo. Okay, so let's just go back to the people I've missed. Sarah James. Thank you, and Emmy Watts. Right, thank you. That's everyone I have on my list, Chairman.
Brent, can I speak? It's Jeff Richardson. I'm here to represent HOSP.
Thank you, Councillor Richardson. Noted.
And hopefully anyone else
Yeah, Councillor Bridger here, just observing for Chair of Coco.
Super.
Sorry, Mike.
That's all right. No, I was just about to say, anyone else who hasn't been mentioned, feel free to shout out to make your presence known. And I'm sorry, I should have introduced myself at the beginning, just in case there's anyone new. My name's Councillor Mike Bell. I'm the chair of the Health and Wellbeing Board and the council's executive member for adult social care and health. So thanks very much for that, Brent. Welcome to the meeting. So the first item on the agenda is public participation. I don't believe we have any.
None notified, Chairman.
That's great, thank you, Leo. And as this is the first meeting of the Health and Wellbeing Board that we've had since the start of the COVID-19 pandemic, I thought it was appropriate if we just took a moment of silence in memory of those that have lost their lives during the pandemic. We will be talking obviously extensively about the system-wide response to COVID-19 and the work that's been done, but I think it's right that we just take a minute's silence, if you don't mind, just to remember those that have sadly died during the pandemic thus far. Thank you very much, everyone. Okay, item 4 on the agenda is any apologies. Have we got any apologies that weren't reported during the roll call, Leo or Brent?
No further apologies that I'm aware of, Councillor Bell.
Great, thank you very much. And item 5, which is any disclosable pecuniary interests that any members wish to declare at this point. Nope, I can't see any hands up, so that's great. So item 6 is the minutes of the last meeting, which was on the 5th of March. Jeremy Blatchford.
Thank you, Chairman. I was present at the meeting, but it's not recorded. So I represented Alka.
Lovely. I vividly remember you being there as well, Jeremy. So.
Oh God.
Yes, minutes will be amended to show that.
Superb. Any other comments or amendments to the minutes? Nope.
Councillor Richardson has asked to speak, Chairman.
Okay. Jeff.
Thanks, Chair. Just a couple of things. Also, the health improvement specialist didn't get noted in the minutes as being present. I think she must have been because she gave a paper, I believe. And just a point of order, I guess, is it possible to ask questions about items that are on the minutes, or would that be later in the meeting?
So normally the minutes are for accuracy. Is the matter that you want to raise relevant to a later item?
Probably not, but I'm quite happy to leave it until later on, just to ask the question.
Okay, fine. That would be helpful.
Yeah.
Okay, so if we can make those necessary amendments just in terms of the attendees, and then hopefully everyone's happy to note those minutes as an accurate record. Okay, lovely. So item 7, we haven't got any matters that have been referred to us by the council or any other committees. So we'll go on to item 8, which is the background paper that has been produced by Matt Lenny, our Director of Public Health, which is about the health and wellbeing landscape and the wider opportunities for discussion around some of these outcomes. So Matt, would you like to introduce this paper, please?
Yes, of course, Chairman. Very happy to do that. So I won't run through all of the detail that's in the paper there. I suppose it's fair to say that in the discussion that we had, we talked about recognising the importance of understanding the impact of the pandemic. We've just had that very important moment to reflect on that. But given that we are a health and wellbeing system trying to make hopefully significant improvements in health and wellbeing and reducing inequalities in North Somerset, it is important to see how that's potentially changed the plans that we currently have and how we can strengthen our practice going forward. So what we used to do that is a template which was supplied by the local government association. It was sent out to health and wellbeing boards to consider for their next meeting, because a lot of, like ourselves, a lot of meetings were suspended during the response to the pandemic. So the structure of this paper is very much taken from that local government association paper which was sent round. And what it's meant to be is a few key prompt questions for us to use in working out what we might want to do differently based on our experience. So where is the additional risk, where is the additional opportunity, and in particular, how we might want to work together differently based on the experience of our pandemic response. So I think that's the kind of key driver behind having this paper. And it was felt that it would be helpful to make an inclusive conversation before we take forward any further work, particularly around, and I'll reflect on the health and wellbeing strategy, which was discussed at the last meeting back in March, we haven't been able to make the same progress on that as we hoped because we've been wrapped up primarily in the pandemic response. So it is a recognition of that. But we do have a chance now to reset. We are expanding some of our resources to be able to respond to the pandemic. So we now have a bit more capacity to take this forward. So now's a very opportune time to get the views of the board members and wider stakeholders on what we should be concentrating on and how we should go about doing that effectively based on our experiences. So we could just work our way through the topics in there, if you like, Chair, to stimulate some of that discussion and then use that to do the forward planning.
That's Matt. Thank you very much. And as Matt mentioned, so in Appendix 1, there's a set of sort of themes for discussion, and I think it would be helpful if we just sort of progress through those theme by theme and reflect on where we are as a system and some of the lessons that we need to learn. So I would guess that it's 2:15 now. So if we perhaps take 45 minutes or so to just range through some of these items and have a discussion. I'd really welcome contributions from the different partners around the table. And just for those that haven't had the opportunity to read the paper in detail, so the first area we'll look at is around what the local impact of COVID-19 has been and what that means for our joint strategic needs assessment and our health and wellbeing strategy. What are the things that we particularly need to sharply focus on now in that current context? What are some of the positives that have come out of the COVID-19 pandemic and where there's good practice that has developed that we need to recognise and sustain? What are some of the things that have come through the pandemic which we need to work on and improve? And what are some of the next steps that we might be able to take going forward? So I'm certainly, keen for us to explore what are the kinds of things that we want to get back to return to as quickly as possible that we maybe haven't been able to progress as well during the pandemic. So, the return items, issues which we want to retain, so new things that have happened during the pandemic that have proven to be effective and successful that we'd like to keep going forward. And then obviously some of the things that maybe we don't want to return to, some of the bad habits perhaps and complexities that we absolutely would not want to return to. So who would like to kick us off in terms of the local impacts of COVID and what they think that might mean for the JSNA and our health and wellbeing strategy? Catherine first, please.
Right, thank you. I think the point I want to make kind of covers a lot of the areas, but it's the fact that we've developed a fantastic local network of people who have been brought together under the aegis of North Somerset Together, and have been addressing not just the immediate needs of people in the community to, say, do shopping, pick up prescriptions or whatever, but we have found that they have identified people with problems that perhaps they wouldn't have come forward without the pandemic. There's loneliness, there's mental health issues that have been identified. There have been people who are on the edge of needing, let's say, care and intervention on all sorts of levels, who wouldn't perhaps have approached anybody were it not for the pandemic and these networks existing. And I know that on North Somerset Council we're working hard to make sure that we preserve everything that's been built up through North Somerset Together. And I'm just thinking that in all the points that Mike you just raised, there is so much that these community networks have to offer going forward as a health and wellbeing board that we can tap into and work with. So I just wanted to flag that up right at the beginning, if that's okay.
Thank you, Catherine. That's really helpful. And Jeff, you've indicated to speak. We'll come back to you, Jeff, when you've managed to unmute. It's
so I've unmuted, Mike. Is that okay?
It's much better if you're unmuted. Yes.
Okay, lovely. It was just to make a comment on what Catherine's just said. While I completely support what she said about local networks and the great work they do, I do have a concern about their sustainability once COVID disappears, or I know it's not going to disappear exactly, but and I have experience of this locally in the Clevedon organisation, where they have been losing lots of the volunteers because they've been going back to work. So all I'm saying is you just have to be cognizant of that problem.
Can I just quickly come back on that? We've been discussing that at some length, and we've had a meeting only the other day with the Chief Executive of North Somerset, which underlines our commitment to make sure these networks do continue. But yes, the kind of volunteers and the way the volunteers are being utilised, I would say, will change as the whole COVID situation changes.
I was about to give a signposting to Paul Lucock from Vans, but I see his hands up, so that's very convenient. So Paul, what's your take in terms of the voluntary and community sector, and perhaps touching on some of those issues around North Somerset Together?
Yes, thank you, Councillor Bell. And really, you know, it's just to echo Catherine's point around the kind of increase in volunteering that we've seen across North Somerset, and that response to supporting that kind of community level need. And I don't think we can underestimate the kind of impact that has had and will continue to have, especially in terms of resources on health and both the public sector. But also, we must remember that there is a wider infrastructure that sits around that North Somerset Together piece. You know, we have a voluntary community sector that's existed for a long time pre-COVID, has met a lot of that increased demand within health and social care, out within communities. So we do have a really strong voluntary community sector that sits around North Somerset Together, and that's almost helped North Somerset Together to respond in the way that it has done. So in terms of how we kind of use that and embrace this change that we've seen come forward, it's very much about how do we integrate the new and the old. We bring together what already existed with what now exists, and use that to really continue to support those communities that need, and the ones that we know will continue as we move into this next phase of COVID, however that looks.
Thank you, Paul. And now I've got Councillor Crosby, Mark Crosby, and then Georgie Bigg. So Mark, please.
Thank you, Mike. I just wanted to make a point that is constantly sort of recurring in the forefront of my mind these days. If we're going to provide people with a clear understanding of what a post-pandemic local world looks like, then I think we're going to have to begin to more clearly understand what it needs. And one of the ways that I think we can help that process is through much closer partnership work between this board, HOSP, ASH, Children and Young People's Panel, and COCO and the rest, because I'm a chairman of one of those panels, and I have not had the opportunity yet, and maybe I should just be doing more personally to promote that. But I don't see a strategy out there at the moment that says we should be working together a darn sight closer than we are at the moment as panels. Thank you.
Thank you, Mark. Thanks. Georgie?
Thank you very much, Chair. I just wanted to remind the board of the Health Watch report that came from feedback from individuals that had used various services through the most difficult periods, and what the outcomes of their inquiries were, whether it worked or not. Since then, there's also been a national report from Health Watch England, which I hope to be able to circulate to the board. But I think that document would be a very useful one as a refer list to make sure that whatever goes in the strategy does meet the needs of those that don't normally have a voice at this level. So I just encourage you not to forget those reports and make sure that those small points get fed into the bigger picture so that it meets everybody's needs, particularly the most vulnerable. Thank you.
Thank you, Georgie, and that's a really, really helpful challenge, I think, because there is a danger, I think, that we become fixated with the big picture strategy and we forget about the importance of those small interventions and solving those problems that have been identified through our residents and patients and service users and others. Jeremy Blatchford.
Right. I think what stood out has been that people have actually been working together, and increasingly North Somerset has, if I may say so, has become very much more sophisticated in the way that it looks at towns, parishes and so on. Every community is very different. So we know, for example, the solution in Nailsea would not work in Clevedon or Portishead, and they're going to have to think they can learn from us, but they can't directly copy because it won't work there because it's a completely different community. What we have discovered, and we knew before this, but it's become very much more apparent, is the danger of badging. A lot of people won't come forward with a problem to somebody who's wearing a badge, or if they look at part of the establishment, because they've just been trained and conditioned over the years not to complain. There's been a lot of very good work being done filling up those gaps. I know that issues have been discovered about food banks and how we deal with that, and an old favorite subject, which is of course going to be bound to be school meals. There needs to be a very much bigger strategic view, which I'm sure will come eventually, but there needs to be a little bit more common sense coming out of not North Somerset, but nationally. We need to make our point clear. Engagement with the community obviously has been very good, and we need to continue that and be sophisticated in it. Community transport in the rural areas, I think we're beginning to see an understanding of the problem that many of the little villages have, and this is distorting the housing market and everything else. We need to look at that as to how we deal with it long term. And the other problem, which may not be so long term, is we're entering a period where we may have a lot more need and a lot less money coming in, because government sooner or later is going to dry up, and we don't have the people either, because they'll be hopefully working, but there are an awful lot of changes in there we're going to have to adjust to and be fluid about. And my personal one was coming from a town council which is about to become very rich through the sale of land. It will be very nice to be able to use some of that capital receipt to subsidise some of our community, which we've put £500,000 into over the last 4 or 5 years.
Thank you, Jeremy. Some good points there. Colin Bradbury from the CCG, any reflections, particularly from the NHS perspective, that you want to share with us? You know, just thinking about what the impacts have been. I think we all appreciate the huge challenges and pressure. I mean, quite apart from anything else, you had a full head of hair when we started. But, you know, are there any particular points that you want to draw out and bring to partners' attention?
Yeah, there's no need for that, Mike. It's a bit below the belt, but yes, happy to. So I suppose a few reflections, and they don't neatly fit into the categories, so forgive me. But one of the things, understandably and rightly, we're talking about, you know, getting back to business as usual, and you know, this concept of a post-COVID world. I mean, I think just to sort of temper that with the fact that you know, we are approaching winter, schools are back now, and there is a possibility of a second surge. So one of the, when we say what do we need a sharp focus on, one of the things we're focused on, I'm sure, is preparation for winter and resilience if there was to be a second surge, coupled with the usual pressures on the healthcare system that you get every winter anyway. And so as people will be aware, we're ramping up the flu immunisation programme very significantly, and Dr. Heather might want to say more about this or other things later. And not to forget that within North Somerset we do have some of the most vulnerable populations to COVID, as we understand it, within the wider STP area. So there are certainly factors afoot that would give us cause for concern. I think another thing, which is probably more in the lessons learned or what's been good, is that during the COVID, the first wave of COVID, if I can put it like that, something that we've been trying to encourage people to do for years is rely on more self-care and try and sort of access pharmacy or perhaps have a bit of a watchful wait before accessing health services. And I think that was taken to heart by the public, very much so during earlier months this year. However, the other side of that coin is that we are concerned that people with worrying symptoms that may be indicative of cancer or other life-threatening conditions delayed accessing healthcare for either because they felt that the system was overwhelmed and couldn't see them, or they didn't want to risk contracting COVID by going into to their GP surgery or what have you. And we're really working hard to try and get the message that throughout this pandemic, the NHS has been open for business for routine care, and that hasn't changed. And of course, one of the good things about the COVID stuff is that we were doing well, I think, anyway in North Somerset on digital and remote patient consultations where appropriate, and that's really accelerated in some areas as well. So we've got some really good wins on that we'd like to preserve. I think the other element, and I know we've got mental health on the agenda, but that is something else that I think will be a corollary of this this episode, in that we're expecting a significant increase in the demand for mental health services, and we're putting in place a range of actions. People may have seen the new 24/7 mental health helpline, for example, that's been launched, and we have the Safe Haven Centre in Weston as well, which will further bolster that. So I think that, yeah, so that those would be my initial reflections from the NHS point of view. I don't know if John Heather has anything to add to that.
Thank you, Colin. And yes, John, Dr. Heather, it would be really useful to have any insights you've got from a primary care perspective.
Sorry, I can't turn my camera on. So can you hear me?
Yeah, we can hear you. Thank you.
Okay, that's fine. I mean, obviously, thank you for the opportunity to talk. It's obviously been a challenging time for everybody, hasn't it? And I think we've had to learn to do things very differently, very quickly. I think that we have, as Colin was saying, we have managed to enhance our digital technology. So within Western and world, now every practice is on the same system of Ask My GP, which means that we're managing to get the same offering to people. I think one of the things that was good was because of being joined up as peer health, we managed to come together in a way that enabled us to support one another as practices and therefore to stay resilient at times when in the early days when we were finding that we imagined that the problem would be with GPs or the admin staff going sick and that causing practices to close down. It wasn't actually in that area. It wasn't in the GPs or the nurses. It was more in the prescribing staff that we had problems in some practices, and we were able to move those, the work around to different practices. So I think that primary care has shown its adept at coping with crisis. I think it's probably true that it's much easier to lock down than it is to unlock, and I think that the NHS is still working at doing that. I think that there has been a bit of a misconception that GPs aren't open for business. We most definitely are, but it's in a slightly different way perhaps, but certainly every practice is definitely offering face-to-face consultations when and as needed. I think also it would probably be true to say that at the end of where we are at this moment, it's been a long, hard 6 months, hasn't it? And as much as staff are slightly tired and grumpy, I think some patients are like that as well. And that's fully understandable, but it is putting quite an increase on pressure. So I'm sure it's probably happening across all sorts of areas as well.
Thank you, John, and some really, useful insights there about the impacts on frontline primary care staff, and I think that point about everyone's mood. I think we have really been as a community on a bit of a roller coaster ride in that respect, haven't we? There's been a lot of good stuff that's come out as a result of the pandemic and how we've dealt with the crisis as a community, but I think it is really important that we reflect that that's not universally the case, and people's emotions will have changed from day to day, and that tiredness and fatigue with the whole thing is absolutely a critical factor at the moment. Okay, Jeff Richardson.
Yes, thanks, Chair. I just wanted to reinforce the comments that Jeremy made about transport. This is something that's been close to my heart for a while, in that I think it should be one of the things that's key to a strategy, because access to all the services that we need for some people is dependent on public transport. And if that public transport is not there, that becomes a real issue. And I think that relates to obviously the villages that Jeremy was talking about, but it's other places. There's Cleveland Community Hospital, which people can't get to from Yatton anymore very easily. And even if there is a bus service, it's very irregular and infrequent. And obviously at the moment it's constrained in the numbers. So it's not just that, it's also centralising services in Bristol in hospitals, so that people have to travel in and out, not just the patients, but the people who care about them as well. One other thing I just want, and Colin will know I'm probably going to mention this, is access to services. And while I'm sure in Weston-super-Mare, in John Heather, that's working very well, I know there's a lot of discontent in Clevedon, for example, in the amount of time it takes to, the only way we can actually get appointments at the moment is by calling on the phone, and you have delays of 30 minutes, 35 minutes, 40 minutes before you get through. And I'd also like to point out that while remote access to doctors is a good thing if you can't get anything else, there's plenty of evidence that you lose a lot of the acuity when you are actually not talking face to face to somebody, and people react differently either on the phone or on video, and there is more scope for misdiagnosis and missed diagnosis indeed. Just a point. So while I agree it's a good thing in some ways, you've got to be careful about it in others.
Yes, thanks, Jeff. And I think, you know, some good, useful points there about transport and accessibility, which I think is important. Mark Crosby.
Thank you, Mike. I just wanted to respond to John's comments just now. I think it is the case that whether we like it or not, perceptions are real, and because they're real, they have effect. And the perception that I so often encounter within my ward at present is that doctors, GPs and so forth are inaccessible. And there is a switching off to that, the subsequent switching off of people going, well, you can't get to them anyway, so what's the point? And I wondered, you must know that, John, and I just wondered what you would like to grasp in order to sort of change that and challenge that perception. What needs to be done? Thank you.
Okay, thanks for that, Mark. I'll just bring in Catherine, and then maybe perhaps we can move on, which I think sort of Mark's question does allude to, really. Perhaps we can then move on to what are our priorities for focus. I think we've had a good articulation there of some of the issues and the impacts during the pandemic. You know, some good points about the importance of joint working across bodies, which Mark raised earlier. You know, embedding North Somerset together and the role for the community and volunteers that Catherine and Jeff and Paul and Steve Bridger as well made reference to, the transport issues that Jeremy and Jeff have talked about, the whole raft of you know, pressures that the NHS is under, that Colin and John Heather both talked about. And I think that key point there that Colin made around the fact that we must not fall into the trap of talking as if we're in a post-COVID world when we aren't yet. And I think that is really critical. So Catherine, you just wanted to come in, and then we'll perhaps turn to what are our areas of principal focus at this moment in time.
No, I was just going to reinforce or agree with what Mark said about accessibility and people's perceptions, and to share in a way a direct experience that one of our colleagues, as you and Jeff Richardson know, Richard Tucker, who is going through a lot of the experiences of residents at the moment following his illness, where, like so many people, he is in limbo because of the backlog in terms of, I would say, routine appointments. But, you know, people can't go forward until they get the appointment that they need. And he's very able to navigate that situation, but many aren't. I've spoken to a lot of people who believe that it's even more difficult than it actually is, and who are not, therefore, they feel they shouldn't burden the service, or they haven't got the technology to deal with a video call, and so they think, oh, well, I'll just manage. And because I'm an NHS responder, I've spoken to a couple of people who I've driven to hospital in the end, and they've actually reached a point where they've had to go to hospital because they've delayed and delayed. So I'm just saying that there are some serious issues that are developing because of the COVID situation, and because of people's perceptions around it, which we need to be very aware of.
Thank you, Catherine. So moving us on then to, you know, what do we need to focus on now? So both Mark and Catherine have alluded to the issue around the perceptions of the accessibility of services and the perceptions of the pressure that the NHS was under, because we did clearly go through a phase where the message was very much please avoid going to hospital, please avoid contacting your GP. We've seen the advent of that increased use of digital access, which, as Jeff mentioned, has benefits and disbenefits. So I'd be interested to hear from Colin, who conveniently has got his hand up, and John, in terms of, so what should be the messaging now around that perceptional issue? Because Colin, you talked about the concern that people haven't been accessing treatments, and that in turn is going to cause a pressure now for the NHS. So what should we be saying now to try and address some of those perceptional challenges?
Yes, thank you. And you know, there's a number of strands in this conversation. So, I mean, I think the message has been, well, it's not the case, for example, that the NHS has ever been closed during this pandemic, as we all know. But I understand the perceptions being real, and not to scapegoat, but you know, the national press doesn't help, because there was a headline only the other day I saw that says GPs told to reopen for business, which in fact John and his colleagues have been working tirelessly throughout this pandemic and have been open all the time. And in fact, primary care was open during bank holidays and other public holidays that they wouldn't have normally been open, to try and ensure that people have access to healthcare. But those perceptions are real, and I think there is of course a national campaign to do that. And one of the things that we're looking at across the NHS for the winter is to try and get a greater reliance on phone first. So this idea of 111 being more able not only to deal reactively with queries in the way they do, but also have a way to ensure that they play a more active role in getting people to the urgent care services the right one first time. So being able to give people appointments to go to an A&E department if that's what they need, or a minor injuries unit, rather than people turning up on spec on the off chance and waiting for an appointment. So we're trying to recast the system in a number of quite fundamental ways at the moment. Just to say on the video call stuff, I absolutely accept that there isn't a one size fits all, and of course for many issues it wouldn't be suitable to have an appointment in that case. And John, I'm sure, can elaborate on the sort of categories where it would be safe to have a video call, and where in other cases hands need to be laid on, as it were. I think the other thing that's obviously a very big question, and we've touched on it already in the conversation, is that of planned care. So it is the case that outpatient appointments and routine operations were stepped down during the pandemic for obvious reasons. So the backlog has been growing, and that is a factor across the whole of the country. It's certainly not unique to this part of the world. And the double whammy with that is the fact that COVID precautions now affect productivity, in the sense that beds have to be further apart from one another for infection control issues, for example, so that fewer beds can go into hospitals. So all of our hospitals have lost bed capacity just in time to go into winter, which is obviously not where we'd want to be. But also in terms of wider productivity. So now in surgical settings, for example, the donning and doffing of protective equipment takes more time, and therefore you can do fewer operations on any given list. So all of these sort of headwinds, which are there for very good reason to stop further spread of the disease, means that it's making it harder to catch up on the elective programme. So even if we were to get back up to 100% of pre-COVID activity levels, that would just give a steady state and wouldn't eat into the backlog that we've built up. So as I say, this isn't a problem unique to North Somerset, but I think for the purposes of this discussion, I just thought it would be important to ensure that everyone was of the same understanding. And of course, we have plans to start to address those elective care problems, but it's going to take some time, and so that we need to be open about that, in the sense that we are going to have a period where waiting times for some routine operations and for some non-urgent stuff will be longer. That will vary from specialty to specialty, of course, but I think that that general issue is one that the Health and Wellbeing Board would want to be cited on.
Thank you, Colin, and I don't know if John Heather wants to come in, but I think what would be useful as well is just to think about what can we as a wider system and a wider community do to help address some of those issues that you've articulated there, Colin. So particularly around those perception challenges about access to services and the availability of NHS services, how we can better signpost people to the right solutions for their needs, be that digital 111, the local pharmacy, whatever that looks like. But also perhaps, and I've sort of flagged to Sheila Smith, you know, what does this mean for our social care services as well, which are also closely linked in with a lot of the health outcomes too, and what does that look like at the moment in terms of access and awareness in the community? So John.
Yeah, so yeah, thank you, Mike. I think I can only speak to the Western and World situation, because I'm really not cited on the Woodspring response, and it's different because in Western and World we had already made a strategic decision to implement a digital first solution for patients through Ask My GP. So actually, with the massive digitalization that happened at pace across primary care across the nation, Western and World was actually ahead of the game in that. There was only 2 practices that weren't using Ask My GP. And so we actually were very well, positioned to respond. And I think, you know, that had its benefit. What happened initially was the fact that the demand dropped off enormously. People absolutely, you know, heeded the need not to contact the GP or the NHS except in sort of real needy times. Unfortunately, that seems to have perhaps stood with people longer, and they've either not wanted to access us because they didn't think they should, or they've not wanted to access us because they're afraid. And there's an awful lot of fear out there around coronavirus, isn't there? And that does stop people wanting to go to hospital, wanting to contact their GP, wanting to come into the surgery. And so one of the things we have to do is to be very clear about what is safe and what isn't, how we've put things in place to make sure that, you know, when you see us, it's absolutely okay. But it's really important to access us. We want to be open. We want to be offering as good a service as possible. But because we had made that strategic decision, I think that we are, I mean, we are challenged, don't get me wrong. I mean, there's lots of problems in Western and World, but you know, in my practice, people can get through, they can see us. We are handling, for the most part, we're handling the demand that's coming our way. In terms of videos, I mean, I'm sure this would be true for other, I mean, we rarely use video calls. It was something that was seen as really important in the height of the pandemic, because you were trying to access people who had respiratory problems. You were trying to gauge how unwell they were. But to be honest, the majority of consultations don't require a video. The majority of consultations can be done really well through email. If they can't be done by email, they can be done over the phone. If they can't be done over the phone, then a few perhaps would benefit from a video. But other than that, people can come and see us. But because we've taken a good history over the phone, when they come and see us, it doesn't have to be for quite such a long time. I think one of the things is also what we have to get across is the fact that coronavirus means that everything takes longer and it needs more space. So when you're thinking about the flu vaccinations that are going to, you know, we're embarking on at the moment, that's a massive logistical problem for practices, because, you know, normally when you have a flu clinic, you have hundreds of people turn up on a Saturday morning or whatever. And, you know, we cope with it pretty well, but it's a lot of people very close together, and obviously we can't have that. So it's rethinking and having one-way systems and making sure that people can be socially distanced while they wait, and that's a very different procedure to what we've ever had before. So I think practices all around North Somerset and all around the country are, working hard at trying to sort that out. In terms of the messaging we need to get out there is, I think it's safe to see us and we want to see you.
Yeah, thanks, John. That's really helpful background, and it just just take the opportunity to thank you for joining the board, because I think it is really helpful to have the real practical experience as still a practicing GP, but also in terms of your leadership role in the wider primary care sector. So it's a really helpful insight for us as a board. So what about others then? Any thoughts on what we should be focusing on particularly now? So I think we've heard very strongly that we need to do more around the return to normality in terms of accessing health and social care services. Sheila Smith has stepped away, but I think our message in terms of social care is absolutely social care is open for business and accessible, and we aren't in the world now where people should be reluctant or nervous about making contact, getting an assessment and receiving the right kind of support, be it in the community or in a care home setting. And we do need people to make good decisions about that now, day to day. But what else do you think that we need to be looking at as a particular area of focus right at the moment? Matt?
Thank you, Chair. So as a bit of a bridge from the challenge we have around making sure people have good access to services and working through some of the backlog, I suppose it's also focusing on the outcomes that we need to affect most. So where the burden of ill health and poor health and well-being is within our population. So I think it is about how we continue to concentrate on the big drivers for poor health and long-term conditions. So the topics that you'd probably expect me to talk about, things like mental health and well-being, healthy weight, physical activity as a important factor in both healthy weight and mental health and well-being, but also sort of more high-risk behaviours around things like smoking, alcohol and substance misuse. So I don't think they've gone away. They're still there and they're still potentially driving some of the demand into our services. But I suppose the thing that we have to keep our eye on, and I know we were talking about this before and it has to be in the health and wellbeing strategy, is the particular focus on inequalities, because we know that that's disproportionately affecting parts of our community, and COVID will have potentially exacerbated that dynamic. So we need to probably describe what we knew before COVID, how that may have been accelerated by COVID, and therefore what disproportionate effort we need to make in certain communities, working very much picking on the first point around working with our communities to then make sure that we've got an accessible and an acceptable message for communities in terms of different services, different interventions, different community structures that are going to be effective for people to think, well, yes, I do want to quit for COVID, for example, as a risk factor in having poorer health complications, or indeed potentially I want to get to a healthier weight because I realise that's an additional risk factor. So there's risk, but there's maybe opportunity there to change the narrative slightly. If we get the messaging right and the context right, we might be able to have a different type of conversation which people are more willing to listen to.
Yes, thank you, Matt, and I think that it's a good reminder of some of the key challenges. In my day job, I work for a charity that works with blind and partially sighted people, and one of the things I've been saying a lot is that actually COVID-19 for blind and partially sighted people has just exacerbated things that have always been true. And I think sometimes we go around looking for new problems that have been created as a result of the pandemic, when in reality what we should be doing is looking really at the things that have been exacerbated by it, because I think there's a lot of it which is not new at all. So that's a really good reminder, Matt. Catherine.
Yeah, I was actually going to make a similar point about it exacerbating the existing health inequalities, and as you have said, and particularly it's exacerbated, COVID has exacerbated anxieties in some communities, particularly the Black and ethnic minority community, because of all the messaging about them being more vulnerable per se. The other thing that I hate to mention, but I will, is the whole furore over testing, and the fact that there's now a perception amongst people that, you know, they can't get tests, they're not going to get tested. There's a lot of anxiety, especially amongst young families with children at school. They hear of a case being identified, they want to know, they're contacting me saying, well, I can't get a test, I've been driving here, there and everywhere. Facebook is alive with this, as I'm sure you're well aware. And it is causing anxiety. So I'm just asking Matt, you know, what can we do? I know we don't control the access to the laboratories, and if there's a backlog in processing the testing, that's perhaps not down to us. But how do we allay people's fears and make them feel it is worth trying to get a test, and just ramp down that anxiety? Because there's so many other things to worry about at the moment that, you know, people don't need this as well.
Thanks, Catherine. Can we leave that one for a moment, and we'll come back to some of the immediate COVID issues, perhaps. But I think testing is absolutely central to that at the moment. And Jeff wanted to come in.
Thanks, Chair. I just wanted to mention schools, really. They must be absolutely key to what we do during the COVID period as it carries on. And it brings me back to one of the things I wanted to mention that are in the last minutes about the mental health support teams in schools and whether that's carrying on. Obviously, children are going to be very worried about this and they need support during this period.
Yeah, thank you. Maybe if we pick up the specific details of that in the next item, because we've got mental health on there, but you know, clearly in the current situation, one of the priorities that have come out, I think several members have already referred to it, is the challenges that people have faced with their mental health. You know, so for me, you know, going back to Matt's articulation of the key core challenges, when we think about mental health, healthy weight, physical activity, smoking and substance and alcohol misuse, which are the key drivers for poorer health outcomes, all of those have been exacerbated to some degree. There's lots of evidence that more people are drinking to excessive amounts, for example. Physical activity during lockdown, we know, declined amongst some people. Eating habits changed. I mean, certainly I know I ate more during lockdown than for a long time. And we know there have been real pressures in terms of people's mental health. So what are members' thoughts about how we can transfer that articulation of the challenges into a real sharp focus on the things that we need to act upon, and what does that look like as a joined up health and well-being system? Answers on a postcard. Georgie's hands up. Brilliant. Georgie's going to solve it for us. Great stuff.
Thank you, Chair. I think I'm reminded now of a key thing that I know was picked up by officers at North Somerset, but you know, we assume that all the communications we put out, whoever puts them out, you know, is received at the other end in the way that we hope it is. And unfortunately, we know from our feedback that we had that despite all of the local messages that were going out, the population were receiving in the main just the government messages, and possibly those from the press as well, which has been mentioned are not always completely up to date or correct. And so I think that whatever strategy we decide on, we need a coordinated communication, and it would be very good. I know we've all got our own logos and everything, and we've all got our different responsibilities, but if actually that communication strategy connected to it actually looked the same, and we could then enhance that communication by it being repeated through whichever channel they receive their information, I think that could be, you know, a lot better in terms of getting the message across. So I don't know if that's possible, but I think that we're all trying in our different ways to get those same messages across, but if it could come as one message from all of us, and find a way to do that, I think that would be really good.
Thanks, Georgie. I think that's a very helpful point, and I think it has improved a bit in the last few months. Necessity has driven it, but I think it is a good point that particularly in terms of health and well-being, we are not always as joined up as we could be. Local public health teams, Public Health England at a national level, what our NHS partners are saying is not always as integrated and joined up as it could be. And I think one of the things, just to echo what you said, one of the things that has definitely come across from residents has been that lack of clarity about what they're supposed to be doing and what they're not supposed to be doing, and what are the right behaviours and the right actions. And some of that is absolutely linked to the importance of clarity of messaging and communications. So I think that's a really, really key point. Matt.
Thank you. I was going to pick up on that actually, because I was just going to talk about whether there's particular bits of work we could do together based on insight about certain cohorts in the population. So rather than a top-down, here are all our messages, please take them and absorb them, we do more of a bottom-up approach of what actually works for you in your daily life, what are your trusted sources of communication, so that we find ways to be able to make it adaptable and digestible for people in a space and a time that they would expect to get that information. So I would agree that with Georgie that if we did a bit of work on that, and maybe we pick 2 or 3 priority groups that we would want to communicate with particularly effectively, and test that approach out as a wider partnership in coordinating our approach. And then also I'd also pick up on again experience from COVID, which might point us towards in terms of longer health and well-being approaches. So Jeff kindly mentioned about the schools. I think also, it's been a really difficult time, but actually some of the depth of understanding and relationship, not just with schools, but also our care homes, as really important settings of health and well-being in our community, not just through the residents, but through the staff and the families. You've got whole networks of community within community in those types of settings, and there may be opportunities for us to we've had to work together very closely because we've been trying to manage the impact of the pandemic, but there may be opportunities for us to think longer term about how we can work together to reinforce opportunities for people to improve their health and well-being and access the right type of intervention and support that they might need. So I think maybe settings is an area we might want to explore, because that's a massive reach into the community and a place where people will naturally congregate and probably trust the information that's given to them in those settings. So that might be something we want to look at as a board.
So just thinking about what are our takeaways from this conversation. I mean, a lot of this does come back to the need for us to articulate, and it sort of brings me full circle back to Mark's point at the beginning about joint working and joined up thinking. A lot of this does bring us back to the issue of some clarity around what our health and well-being strategy is as a board and as a joint partnership across health and social care and beyond. And how we articulate that. And I think we do need to put some definition around how we are going to turn those wider determinants into practical actions, where the priorities for focus sit both geographically in terms of some of those points you made, Matt, about the inequalities of outcomes that we've got in a geographical and demographic sense, but also where those responsibilities sit in terms of the system. And I think there is a danger that we get blown off course because there are lots of bigger, more strategic conversations at the wider BNSSG system level and indeed nationally too. But we do need to have that sort of relentless focus at a local level around the key actions that we can take that will make a difference to our communities, picking up some of those smaller wins that Georgie talked about earlier, and tackling those health inequalities, but also that wider strategy for North Somerset. So it feels to me that that's a key area for us as a board at our next meeting to really begin to move on that health and wellbeing strategy and what that looks like, and maybe not falling into the trap of thinking that because we're in this COVID world that some of that is blown off course, when, as many members have already said, actually all it has done is amplified and heightened some of the pre-existing challenges that we faced. Colin, you wanted to come in.
Yes, thanks, Chair. So, I mean, just on that issue about targeted local stuff, it's certainly something that the Western Integrated Locality Provider Group has been looking at, and everyone on this call knows that there's a wide range of health outcome within North Somerset. One of the things that's particularly pronounced in Western is that Western residents tend to access A&E services at a far higher rate than the rest of the STP area, the rest of BNSSG. So we're obviously going to have national campaigns and messages about choosing well going into winter, but one of the things that we're exploring at the moment, and it's still work in progress, is the possibility of a more targeted local tailored campaign for Western residents, because they do rely on A&E as their sort of default setting of care more readily than others, and that's not a criticism of the residents, it's just the way things have played out, in that we don't have a minor injuries unit in the patch, and primary care in some cases historically has been challenged, although that's changing. So a targeted Western campaign may be one of the things that we might want to put forward as that sort of local reactive strategy to some of these things.
Thank you, Colin. And so, Matt, I mean, do you want to just give us a flavour of where you think things stand at the moment in terms of that health and wellbeing strategy, and how we might usefully take this work forward? So in the discussion paper that was circulated, we sort of floated whether we wanted to have some sort of development sessions that are focused on some of these key challenge areas that can help us as a board and a group to informally focus down in some of the specifics to help develop a wider plan. Do you think that that's a useful way forward, or is there a different approach that you think we should focus on?
Thank you. Yes, I was. That's great, because I was just going to come in at that point to talk about that. So now is a good opportunity maybe just to introduce a new colleague who's joined the team in public health. So Georgie MacArthur has just joined us as a consultant in public health, and Georgie's going to be leading on inequalities, and part of the role will be very much focusing around what we're going to do in terms of developing the health and wellbeing strategy. So and Georgie's on the call now, so I'm sure she'll say hello in a minute, but what we're going to be doing is pulling together essentially a project plan between now and with the target date of certainly by the end of March next year. So within the rest of this calendar year, by that point we will have produced a health and wellbeing strategy, and within that then we will have opportunities for board members to contribute to different work streams. So there'll be something about the outcomes that we want to focus on, so that we can hone in on those and then think about what our priority areas of focus are. There'll also be something about how we work together. So, for example, the bit that Georgie's picked up on in terms of how we communicate effectively, or also the beginning part of the meeting where we were talking about how we work with the voluntary and community sector. So there's something on what we're focusing on, something about how we're going to deliver it, and what we'll do is then share around with the board members some opportunities to be able to do that outside of the formal meetings, where we can get into a bit more of the detail. And then at the next meeting of the board, we'll be coming back with the product of some of those discussions, with a clearer sense of this is what a draft strategy is looking like. This is what people are. Essentially, this is what the evidence is showing us, the data is showing us, the evidence in terms of what interventions might be most effective in the action areas we might want to take forward, and also, how we're going to work together to get there. And so we can have that continuous conversation from now all the way through until say March next year, where we actually sign off a strategy and say these are the things that we're going to focus on as our priorities, and here is an action plan to be able to deliver it. Because I think you're absolutely right, that's the key bit, to say now we've agreed that these things are important, what are the steps that are going to take us there, and that will be reliant on each of us giving our contribution through the different areas of work that we lead, or the different organisations that we're part of. So that would be my proposal, that we make contact with the board members outside of the meeting, and then continue that dialogue, and then come back to the formal meeting with a next stage development, and then go all the way through to a final plan. I don't know if board members are happy with that approach, but that's a suggestion of how we could go forward.
Thanks, Matt. I mean, I think that feels very, very sensible to me. Sheila, you wanted to come in?
Only just to confirm exactly what you've said, Mike, I'm fully supportive of Matt's suggestion. So yes, eminently sensible. Thank you very much.
That's great, thanks. And Georgie MacArthur, do you want to just introduce yourself at this point and add anything from your perspective? And welcome to the meeting.
Thank you. Absolutely. Yes, I'm Georgie MacArthur. I joined North Somerset Council last week as a consultant in public health, and one of my areas will be focusing on this strategy and inequalities. I think Matt covered it really well. The work's being shaped at present, and very much look forward to working with the board around priorities, ways of working, how best to engage with all of the partners. And yes, I'll be in touch with members outside of this meeting to take the work forward.
Brilliant, thank you, Georgie. And I'm going to bring Jeff in. Jeff Richardson.
Thanks, Chair. I just wanted to know how this fits in with the joint strategic needs assessment, which I don't think we've produced yet, and it must be very closely entangled one with the other, I'd have thought.
Matt?
Yes. Yeah, that's fine. Happy to pick that up. So the Joint Strategic Needs Assessment is one of those areas where back in March we were about to launch on a certain course of action, which got slightly waylaid, partly because some of the software that we were trying to get in, so the Power BI system, which is a Microsoft system, which is it's a much better way to display data and make it more accessible for people to interpret in different ways. So you can look at you can put different indicators together, you can do it over different geographies, so it's quite a useful tool for board members and any of our local stakeholders to be able to understand what the situation is in North Somerset. So we're problems developing that, and then capacity, but so our business intelligence team is now back on the case, because we've got some additional capacity through our local outbreak management plan to be able to deal with some of the pressing issues, which creates some capacity to be able to take the JSNA forward. So in my conversation with Emma Diaco, our business intelligence leads last week, she's already working on that, and we will share around drafts of what that system is going to look like within the next couple of months, and then come through to December with a sort of fully fledged version of what that system will look like and how people could access it and use it. And what we'd envisage as well is not just to build the system, but maybe to offer some online tutorial type things, webinars where people could come along and understand how you can use the system effectively, whether you're a local charitable organisation, whether you're a statutory responsibility public sector organisation, or a community-based organisation. You could understand how you could use the JSNA portal to better describe what's going on in your local area and understand where the priority areas might be for you to focus on. So that's the intention. And again, we can provide a bit more of a briefing material around that alongside the development of the health and wellbeing strategy, because yes, we will want to keep a constant eye on what the JSNA is telling us in terms of local population need. We'll also want to link it through to the latest evidence about what's most effective to be able to meet that population need as well. So again, it's an apology that hasn't gone as fast as we wanted it to, but it is being rebooted now, and that's something that we'll keep pushing and report back on, if that's okay.
Okay, thanks, Matt.
Yeah, thank you, Matt. And I think it's fair to say that we started 2020 with a quite a clear plan in terms of the JSNA, in terms of our health and wellbeing strategy, and some of the workshops that we'd done towards the end of last year and early this year around tackling health inequalities. And I think we had a really clear plan of work, which for reasons that will be obvious, got somewhat impacted by events. But I think, you know, the message, I think, collectively as a system now has to be that, OK, well, we are where we are, and now we have just got to push on all fronts at once, haven't we? We have got to manage the continuing pandemic, and we have got to demonstrate progress on some of these other challenges too, because, you know, we don't know how long the current situation is going to go on for, and I'm afraid we're all just going to have to get used to keeping lots of balls in the air at once. OK, so I'm going to wrap up conversation there, because I think, as Matt suggested, if members can reflect on some of the questions and points that are in the discussion paper that was circulated with the agenda, and provide any further feedback to Matt and Georgie MacArthur on any particular thoughts that you've got on that. But otherwise, we look forward to hearing more as the work to develop the plan for the health and wellbeing strategy and tackling inequalities moves forward. So I can't see any further hands. So before we go on to the next agenda item, and without wanting to cut across the Outbreak Engagement Board, Matt, do you want to just comment on the current situation in terms of COVID cases and also the testing scenario in North Somerset at the moment? Because obviously Catherine did raise that, and I'm sure many members around the table will be interested to know where we stand at the moment.
Yes, of course, happy to do that. So I'll maybe start with the testing and then move across into where we think we are as a local community. So the testing availability and the response times in terms of when tests are taken, how long it takes to get a result, are both big challenges for us. That's not just for us locally, but across the country. I think it's fair to say that these are issues that have been flagged not just now, but over the last probably 3 to 4 weeks now, by not just Directors of Public Health, but by Public Health England, with the national team responsible for the Test and Trace programme. I'd like to be able to say that, don't worry, there's a perfect solution just coming around the corner, but it looks like it's going to be a slightly longer process than that. The clear feedback we're getting, and you've probably read some of this in some of the media and other coverage, is that it's about lab capacity. That's being built over time. In North Somerset, what we did do, I think, quite early on and to good effect, was create access points for people to get tested. So we have our regional site at Bristol Airport, but we also developed the mobile testing units both at Locking Road and at the Castlewood car park in Clevedon. They were running pretty well. They were seeing, you know, reasonable amounts of people, and that grew over time. But we're now in a position where we're seeing less people in those sites because they are controlled by the national system and less slots are being offered to local residents. That is a source of great frustration, not just for them, but for me as well, because we need that information to understand what the true incidence rate of COVID is in our local population. And when we have individuals who are identified, to be able to contact trace effectively and to try and limit the spread of the virus. Without regular testing, you lose that oversight and you lose potential control, which is a concern. So where we are now is that that has been recognised. We are expecting that we might get some more information soon about some prioritisation around testing access, because at the moment a lot of the whole testing capacity is going to those areas of higher incidence. So we're seeing a lot of places, particularly in the north of England, where additional testing capacity is going in. So that's understandable to some extent, because you want to make sure that you're controlling spread there. But meanwhile, you could be sleepwalking into much higher rates in other parts of the country, including down here in the southwest, where we have relatively low rates of transmission, albeit still rising at some point. So we're waiting to see whether we're going to get a more structured approach where every local area will at least be able to prioritise some local testing capacity, particularly around higher risk or key locations, like for example our healthcare workforce, who do access through a slightly different system, but there are some people around the edges of that also need good access to testing. We've got our workforce in the care system, we have people working in schools, we have other, sort of key worker locations, and it's not just about the individual workers, it's also about their families, because we're noticing now with schools having to send sometimes whole cohorts of children home to isolate. That's affecting the key worker in their ability to get into and to deliver the service that they're keen to do. So we are waiting for more guidance nationally around that. If we get that, then obviously we'll be cascading that information out so people can understand. And we're just not sure yet what the process will be in terms of managing any local targeted testing capacity, whether that will come through myself as the Director of Public Health, whether that will be through the national testing system. We don't know yet, but hopefully we might be able to at least help some of those people in the most frustrating and challenging situations get to a test quicker and get to a result quicker, which is also really important. So being honest, that's kind of where we are now, in a space waiting for a bit more development from the national system. But I suppose it's important to emphasise that the lobbying has been strong and consistent for a number of weeks, including the Leader of the Council writing to the Secretary of State, and some people may have seen him as part of a news broadcast last night talking about that. So we have been advocating on behalf of local residents, and we understand the frustrations and ask them to bear with us as we try and find solutions to that. In terms of the overall picture around COVID in North Somerset, so we have had some rising incidents in North Somerset over recent weeks. At the moment, it seems to be coming down a bit, but I suppose, and that would normally be a source of great delight for me as Director of Public Health, but given what I've just said about testing, the only concern is that a true picture of actually what's happening in the population? Are we recording the real incidence of COVID? It's the only data that we've got, so we have to go with what we've got. But certainly in terms of the latest numbers are showing North Somerset coming down underneath the national average and coming much more down towards the Southwest regional average. So we're looking a bit more typical, alongside our neighbouring authorities. But I don't want to overplay the assurance that gives us, because ideally we'd be testing as many people as possible to give us a really true picture. We are continuing to work with our local settings, so our schools and our care homes. We have had some situations in both of those types of facilities, but I suppose the important thing is that where that's happened, we're trying to communicate well with those settings, work with them, both in terms of local public health team and other officers in the council, plus the Public Health England health protection team, which works at a regional level to provide specialist advice and support. So we're using as many mechanisms as we can to get alongside those settings to help them deal with the challenge, and it is very challenging for them, and work our way through solutions as best we can at the moment. So that's a broad overview. I don't know if anybody wanted to ask any particular questions, but that might just give a bit of context.
Thank you, Matt. And just to put things slightly less charitably, I think it's fair to say that the current situation is obviously a bit of a shambles, particularly in terms of the access to testing. And we have been picking up a huge amount of frustration and concern and uncertainty from residents who are trying to do the right things in terms of accessing tests, not able to do so, or being signposted some distance away, and more people as well who have had tests but then had to wait long periods of time to get the results, and that includes some sensitive settings where we really would have wanted to see faster turnaround in terms of test results. I mean, unfortunately, as Matt says, a lot of this is out of our hands and we can only lobby, and I'm sure that colleagues in this meeting will be doing likewise through their own channels because it is absolutely key to the sustainability of any arrangements that we put in place to manage and contain COVID-19, that we have a good test and trace operation. It certainly feels at the moment that every step forward we take together, there's another step back somewhere along the line. And as we see the NHS contact tracing app launching next week, which hopefully will be a positive benefit for everyone, we see ourselves with these significant pressures in terms of testing. But I think, you know, our message is absolutely that we're doing everything that we can as a council. Matt has done a great job as our Director of Public Health, advocating for our community through all the opportunities that he's got regionally and nationally, and we'll continue to do that. And I'm sure that it'll all get there in the end, but it's certainly deeply frustrating. So I've got Jeff and then Mark.
Thanks, Chair. It's just a question for Matt. Has the demise of Public Health England had any material impact on what we're doing, Matt?
So I don't think that's the case in terms of the response to the pandemic from the Public Health England point of view. So our colleagues in the health protection team, who I have to say have done an excellent job in very difficult circumstances. They are under huge pressure at the moment, but continue to provide really effective advice and support for us and local settings. So I wouldn't say that's had a direct impact on them at the moment. There is the interesting question about what will happen next with some of those functions. There was an update on that a couple of days ago, which was published, which just sort of reaffirmed the timetable for the development of the National Institute for Health Protection and some notions around what might happen with the rest of Public Health England. But it's quite vague at the moment. It's a sort of general statement of direction, but we'll have to see what happens next. But the health protection support has been good, continues to be good, although fair to say that it's quite stretched at the moment given the volume of issues that they're having to deal with.
Okay, thanks, Mark.
Thanks, Matt. And Mark.
Thank you. Speaking personally, three of my grandchildren have been tested so far for a variety of reasons. And what concerned me is that there is still a degree of inconsistency about the reasons why. And I just wondered whether should we be doing more to get that consistent message to the school gate and into the schools more consistently, I guess, from that point of view. As I say, there is clearly in three cases an inconsistency, not incompetence, just an inconsistency of what was driving and determining the decisions and the need for the test. Thank you.
Yeah, really good point that I'm sure, well, I've got Sheila and Catherine, so that they'll both want to allude to. I mean, as a parent with young children, one at primary school, one at secondary school, I think the schools have done an excellent job in terms of trying to communicate and understand the rules and the guidelines, but I think there is a lot of confusion. You're absolutely right, and I think there probably is an abundance of caution that isn't always justified, but perfectly understandable. Sheila, do you want to come in first and then Catherine?
Okay, it's just very quickly really on Councillor Crosby's point. So I think in North Somerset, we've tried very hard with our schools, regardless of whether they're academies or LA maintained, to make sure that the guidance they get mirrors the Public Health National Guide, Public Health England National Guidance. And certainly Matt and I have had conversations with our heads, and we've got subsequent ones booked in. In terms of interpretation, it is often a fine line because there are I can think of just the last handful of school queries that we've had come through. There's some nuancing there, and Matt's been very good at trying to steer a path. But nevertheless, it probably looks like it's inconsistent. The final thing I just want to say is that up until yesterday, all our schools nationally were very clear that they reported in to PHE any of this. We, late last night, became aware that the government's changed its mind, and so from now any reporting by schools of any possible COVID cases has to go into the DFE, not PHE. Now, I will just say, and I know it's a public meeting, it's actually been really unhelpful for us in the local authority, where we've been consistently giving out guidance around Public Health England. They also have been helpful to our schools. And so I will just say to members, there will be that quite significant change. We are sending that message out to schools, but it's just a sign, I guess, that actually there's a lot of churn here, and we're doing our level best with our schools to keep up with that guidance. So I thought it was useful to people to know that.
Thank you. Thank you very much. Thank you.
Thanks, Sheila. And Catherine?
Well, not surprisingly, I was going to say very much the same thing, that my experience, the schools have worked incredibly well with us and with parents to get messaging out. And what I would say is most of the frustration I've come across with acquaintances and former colleagues is that teachers have found it quite hard to get a test. I mean, I've got a friend who recently felt a little unwell and did the right thing and notified and put in for a test. It has taken her 10 days to get a negative result, during which time she's had to stay off work, and she's actually kept her children at home because of the uncertainty and wanting to be very responsible. So I welcome hearing from Matt that perhaps there'll be some form of prioritization for people who are in sectors where they need a fast turnaround. When she finally got a test slot, the result was quick, but it did take a significant length of time, and it increased the anxiety, which we alluded to before. This whole thing builds into a situation where people do become fearful. But yeah, our schools are doing a brilliant job, I would say.
Yeah. Thanks, Catherine. Right, I'm going to move us on to item 9, which is the Mental Health and Wellbeing Strategy Group proposal, which we've got a paper on. Who's going to introduce this one? Is it you, Matt, or?
Yes, very happy to, if that's okay. So hopefully this paper it's a bit of an articulation of what we were talking about earlier. So thinking about some of our priority outcome areas, and we've talked in this board about mental health and wellbeing a number of times being a key part of any health and wellbeing strategy. So the proposal here is that we've got different bits of work going on in different places. What we'd like to do is to bring together a task and finish group specifically looking at mental health and wellbeing, so that we can draw in the threads from different areas, so local authority activity across a range of our different officer groups and settings, working with colleagues in the NHS, working with colleagues in the voluntary community sector, thinking about opportunities around any of the national programs that we can do. So it's to have a group which will give us an overview specifically for North Somerset and across the life course. So we think about early years, we think about school years, we think about adult and older age individuals in the community. What are we doing in each of those spaces to understand and respond to need effectively? So some of that's about thinking about mapping of what's already existing. It's about where the opportunities are to expand that. And if there are gaps in provision, then what can we do to try and improve that to address the outcomes that we need to do? So not jumping ahead of the health and wellbeing strategy, but trying to get on with something that we know is live and something that is potentially getting worse as an impact of COVID. It was to bring this group together to get some agreement from the board that it would be worth having a specific North Somerset group. We will obviously engage with everybody who might need to be engaged in the development of a plan for North Somerset, or at least a collective sense of where we are and where different aspects of work are going to be fulfilled, and relate that to some of the other pieces of work that are going on. So for example, the Healthier Together work that's gone on around the all-age mental health strategy, which is really helpful, but we probably just want to try and say, and in North Somerset, what does that mean for us, and how can we push forward some of those ambitions as quickly as possible? So that's the proposal, and I'm happy to take any comments or suggestions or contributions to that type of approach, please.
Great, thank you, Matt. And I've got Colin first.
Thanks, Chair, and thanks, Matt. So I guess one of the things I'm mindful of is that there are a large number of mental health groups within the BNSSG system at the moment, both strategy groups or task and finish groups, or a combination thereof. And I guess what I didn't get for the paper is whether why it wouldn't be possible to get what we need out of the existing sort of governance architecture, and why we'd have to invent a new and separate group. That might be the case, but for me, I didn't quite get the rationale for it. I can see why we'd want to focus on specific stuff for North Somerset to support the Health and Wellbeing Board, but by the same token, there's a risk that by having a separate group, we lose contact with the wider piece. We've got major providers such as AWP and Vitaminds who are not even limited to the BNSSG area, never mind North Somerset. We have the mental health business case. We obviously have the SDP strategy group that Joe Walker chairs on behalf of BNSSG. So as I say, lots of groups, lots of work going on. I just wanted to have a little bit more of a sort of understanding as to why we need another one on top of that, and why that wouldn't be, those objectives wouldn't be achievable through other means.
Thanks, Colin. So some good questions there, and I'll throw a couple of additional ones into that. So firstly, how would this fit into the work that we were talking about earlier around the development of a health and wellbeing strategy and the processes that we'll put in place for that, including working groups and so on? And how will this group be placed to articulate, as part of that wider system approach on mental health, the particular needs to level up and improve mental health outcomes and the range of services available in North Somerset? So I'd just be interested in those 2 points. And also, additionally, what's the role of this board in the context of this mental health group, and the role for elected members? Do you want to take those, Matt?
Yeah, sure. Thank you very much. So I think I recognise what Colin's saying. Absolutely. I think what the proposal was about was so there are those groups, and they are doing effective work without a doubt in terms of looking at different ways in which we can improve provision, and we can, join up services. I suppose the one area where this group was particularly trying to think about opportunities was much broader than the healthcare system, so much more into the prevention aspect of mental health and well-being, so the wider determinants of health and well-being. So what we could be doing more of in the context of children and families, in terms of community activity, in terms of in relation to other key services where we know there could be additional risk factors. Could we think about things like housing? We could be thinking about education. We could be thinking about employment opportunities, workplaces, those sorts of things. So it's not to say that we wouldn't then use that group to then push those opportunities, those observations, those working relationships back through into the system, but it's almost like to take a step out and just to take a North Somerset view of where we think we might need to go to meet the particular needs of our population. It doesn't cut across those groups. It hopefully would enhance the contribution that we can make into those groups from a North Somerset perspective, because we've got a range of professionals who are thinking that it would be useful to have a space where we can have a bit of that collaborative discussion about North Somerset needs particularly. In the same way, for example, with the locality groups as well. So if you did the same sort of what's going on in North Somerset, where the opportunities, particularly the preventative end, then how could we work within the context of locality groups to take up those opportunities and work effectively with different partners? So, and by the same token, that kind of step back, take a view, understand, may turn into some sort of overview, a report, which could then be fed into discussions about the health and wellbeing strategy. It would pick up on where are the gaps, where do we think we need to do better, where are the opportunities to strengthen our approach, and then that would empower the board, essentially, I suppose, to say, yes, okay, this is useful information. This is telling us more about what we might need to do as a collaborative effort alongside the other forums where action's being taken forward. And then the sort of the power of the board to be able to say, right, okay, let's get on and fulfill our different responsibilities within our different roles. So I don't think it's a if you like, an undermining or a threat to any of those other processes. It's more getting a good narrative for North Somerset by having a focused bit of work. That's why it's called a task and finish group, so it's not a forever thing, but we can do a focused bit of work, particularly around prevention and early intervention, to get the longer term population health benefits that we'd really all like to see in terms of outcomes for those individuals, those families, those communities, but also the potential benefit in terms of some of our service areas to deal with need more effectively early, and therefore possibly reduce pressure on some of the services which we know are already very stretched. So that's the philosophy behind it. What we could do is take it away, come up with a bit more of a terms of reference, a bit more of a scope, share that around as get another sense check on whether people feel like that's doing the job that I'm trying to describe. Maybe not very well, but trying to just give an overview of what it is. And then if there are observations and challenge back on some of those areas, then we can incorporate that into how that piece of work's taken forward, and of course report back to the next meeting of the board to say, so we've gone away, we've had a look at this, we've taken some feedback, and now this is where we think this might add some value, because that's what it needs to do, not get in the way, but add a bit of value to getting a North Somerset view on a few of those issues.
Thanks, Matt. And I think it's also worth mentioning that we're talking about here as well, bringing together the work of 3 existing groups that operate in North Somerset, the Future in Mind group for children and young people, the Perinatal Mental Health Strategy group, and the Suicide Prevention Steering group. And I can see that there's clearly overlap between the services and the interventions that those groups are looking to support that could usefully be articulated at a more joined up and integrated approach. I think the other thing is that I hope that this is part of a response to the challenge that we heard a little bit articulated earlier around what are the interventions, what is the work that's being taken to more directly support and intervene in supporting people's mental health. And that's not just in the wider context of health services, but also in terms of the work that North Somerset directly commissions and funds itself. And I think we are, certainly as an elected member, I would want to be confident and assured that the limited financial resources we've got in the mental health arena are as effective as possible in terms of meeting some of those challenges that have been articulated. So I think that's part of the mix too. So I've got Catherine Gibbons and then Colin again. Catherine?
Yeah, hi. I just wanted to ask probably a simple question, really. Would you say that the COVID experience has made it more acceptable for people to admit to having mental health struggles? Because in the experience I've had of talking with young people and some of the students that I still tutor occasionally, it's been very much more okay to say that they're finding things hard, because there's been a perception that everybody's been finding things hard. So would you agree that that's been the case? And if it is the case, particularly with younger people, how do we build on the fact that, keep that awareness that it's okay not to be okay, if you know what I mean, that it's okay to have those mental health challenges, and that removing that stigma has, in a sense, happened a little bit with the struggles under COVID? So that's my question. Have you noticed that? And if so, how can we keep that stigma away from mental health issues?
Thanks, Catherine. And Colin, and then I'll ask Matt to come back.
Thanks. Yeah, Chair. So I think Matt's suggestion of a terms of reference that the group could review, just to help people like me with the heart of understanding to get a better sort of picture of what the group's objectives and aims are, would be really helpful, because it is a wide-ranging subject, mental health. And you know, I noticed in the paper related to your comment just a moment ago, Chair, that it talks about this group being a vehicle for supporting future integrated commissioning, enabling the possible pooling of budgets. So I'd just like to know a little bit more about which budgets. And I mean, that sounds like, the CCG is very keen to work with partners, fellow commissioners, to pool budgets. So, but is that the right remit, given it also then goes to talk about social prescribing? We've got, there seems to be quite a wide-ranging remit there that I think a draft terms of reference would really help crystallise some of these issues, so I can see what the main objectives and remit of the group are.
Thanks, Colin. So Matt, I'll hand over to you to sum up, but it sounds to me like where we're at is that, in principle, everyone agrees that mental health is clearly a priority area of work, but perhaps we just need to have a little bit more detail to underpin the specific terms of reference and purpose of this group and how that will interact with the wider system.
Yes, that's absolutely fine, and I'll take your point, Colin. I suppose it's to some extent it's looking at where the potential is for us to do things better, but that might not necessarily be the group whereby you would go about trying to think about an integrated joint commissioning strategy or whatever else. I agree with that. You need the right vehicle to be able to deliver, but it might say these are some of the areas where we might have opportunity, for example, around children and families and mental health and well-being. Can we do more in an integrated way between some of the services that the council either provides or commissions alongside some of our health commission services or our voluntary community sector delivery? Not to preempt that, but it's a sort of an interesting area, isn't it? And if we go from, I think, the needs of the population that we're focusing on and see it from their perspective, if you were a family, what would you like to receive and how would you like to receive it? And then to improve the outcomes in the way that we would all like to improve them, then that would probably just lead us into natural conversations about how we might get better in organising or commissioning our services. So, but yeah, I think that's fine. We can pick that up and definitely work our way through some of the detail, and your input on that would be really appreciated. Just to pick up on the point about, are we finding it more acceptable to talk about mental health? Yeah, I think that is true. I think COVID probably has opened that door up a little bit more. I think alongside other things, I mean, particularly in young people, my daughters are 17 and 20. You can see dynamics in their conversations, in their friends' conversations now, which I would say is massively different to anything that I would have experienced at that age, which is much healthier and much more encouraging, I suppose, that people are going to be able to open up these topics in a way that possibly previous generations struggled. So more to encourage that, and that would point us back to things like working with settings, with groups, with professionals who have real connection with young people, with families, or indeed anybody across the whole life course, to be able to say, this is a safe space, this is a topic that we all have to embrace. So, let's open it up, and by doing that, we'll get to a better place. So, yeah, I'd love to see more of that happening. So, and hopefully through the work of this group and kind of the hard work of everybody in this board and throughout North Somerset, we'll continue to push that message as we go forward. Yeah, I think it'll be really healthy.
Thank you, Matt. And Jeremy, you had your hand up.
Yes, if I were a family in this position, I would be asking one simple question: how quickly do we get support? It's always been the question, but it takes an awfully long time, and things get worse exponentially quickly. That's just.
Yeah, thanks, Jeremy, and a good point. And in fact, it's a very good point on which to end the Health and Wellbeing Board meeting. That we must always be mindful of what are the practical impacts on people and what does it really mean. I know a lot of our school governors are very good at asking themselves the question at the end of the meeting: what difference have we actually made to people's everyday experiences as a result of our meeting? And perhaps it's something that we should consider in future at this Health and Wellbeing Board, and indeed all our meetings. What difference have we really made? So in terms of the Mental Health and Wellbeing Strategy Group, is everyone comfortable that we agree in principle with the establishment of of a group to look at mental health, but that Matt will circulate draft terms of reference that we can agree offline in consultation with CCG colleagues particularly, and then take it forward, because what I don't want to see is us talking about this for the next 3 months and then having to bring it back again in 6 months' time. I'm very comfortable that everyone takes this offline, discusses it, and comes up with a sensible approach. Is that okay with everyone? Good, excellent. Jeremy's given me the thumbs up, and Colin's happy, so we'll go with that. Lovely, yes. Thank you. Oh, it's more thumbs up than I've ever had. This is very exciting. Okay, well, that concludes the formal agenda. So thank you very much, everyone, for contributing. And please, my parting shot is just to say, please do engage with Georgie and Matt when they send you additional ideas in terms of our emerging health and wellbeing strategy and the tackling health inequalities plan, because it really is critical that we have a two-way process, that we don't see the Health and Wellbeing Board as a meeting that we turn up to, participate in, and then go away and don't think about again for another 3 to 6 months. It's really important that we do have that two-way process, that you take information back to your scrutiny panels, to your organisations, to your teams about the things that we've discussed, and then feedback again into the process so that we can get a stronger set of plans as we possibly can. So thanks very much, everyone. Thank you to the officers for supporting us, and thanks to Matt and his team for leading the session for us. Have a good day, everyone.
Thank you very much.